Hello, all. This is Dr. Dheeraj Masapu. I'm a senior consultant in the field of neuroanesthesiology, and today we have Dr. Hema with us. And most of you must have seen her videos in my channel. She has opted for a diploma in anesthesia in Diamond Harbor Government Hospital, and she finished her diploma theory exam. Congratulations, Hema.
Thank you, sir. Thank you so much.
So she's waiting to finish her practical examinations. I think date is yet to come. So before going into the interview, many people who are interested in doing diploma are asking me whether they can go to UK with diploma. It is absolutely possible. For that, you have to clear EDAC examination, and then you need 4 years of experience, and then you can apply for jobs in UK directly. And then Australia and Middle East also, many people are showing interest, but that is not directly possible because Australia and Middle East, they want MD or DNB and 5 years of experience for Australia and 3 years minimum experience for Dubai and Abu Dhabi and other Middle East countries is mandatory. And for Australia, in addition to this, you need publications also. So I think you're clear with diploma. You have to go for MD or DNB if you want to select in these countries. And in India, if you want to continue, then critical care you can directly go after diploma. IDCCM is possible, but 2 years is the course duration. And other niche super specialities are possible only after MD or DNB. So this is all about diploma in anesthesia and different. So in this video, what we are going to cover is about diploma in anesthesia and the examination, and then what are the books and how the diploma students will be treated during the course and after they come out. Also, different areas we would like to cover. So the first question would be, how is the examination going to be in diploma in anesthesia, Emma?
Examination, to be frank, even I was so tense, sir, because seeing my seniors' paper, and then when we got time to study and everything, like I was so much concerned because in first year, even when I gave my FAT exam, usually DNB conducts FAT exam. If it is a 3 years course, it will be like after 1.5 year of your completion, or mostly probably at the end of the second year. And if it's a 2 years course like NBMS, I mean diplomas, it will be around in your first year, end of your first year. So even during that exam, like I was so confused and I did not give it well. And they have even given us the answer sheets and the marks that we obtain in the FAT. So I was little bit tensed. But as soon as I have covered my super specialty training in other college, I started studying more seriously because like just in our exam has been conducted like almost 5 months prior to completion of my course. Like I'll be ending my course soon, like in couple of weeks, and I gave my exam in June. And some of my co-PGTs who are like from service, like they have joined at the end of January or something. Like for them, it is like way far earlier than for me. So there are differences, but for my senior batch, like it's just they are about to finish the course at the end of February or like in the middle of February, and they had the exam during their mid December, just 2 months prior. So maybe post COVID, all these things are being very difficult to predict. Also, that when we'll be having an exam. So I feel like you should start studying from the day you enter into your course, so that you will not be feeling burden of like, okay, at the end of the course will I be able to finish off my exam or not. And yes, the exam was hard for me because of the time management, or like it's been like a long back that I gave a theory exam. And as I have already mentioned, I haven't given my MBBS from India. So even the exams are like completely different from outside. So it's like kind of one very difficult theory exam for me. And I really felt like I haven't studied this much like in my past, like or like 10 years or something. So it was a hard time for me actually preparing for exams. And most of the people even have this doubt that whether we'll be getting any study leave or something like that. So it completely depends on your hospital or the institute where you're taking your course. Because it is all about people who are working with you and your head of the department or whoever it is. So they should first understand the intensity of the exam, or like your importance of like clearing the exam. And also like you should know your ability, like you will be able to clear it in a one go, or like how is your preparation and how confident you are or how hardworking you are. And yeah, definitely you need to keep studying. I won't say that it will be easy, because not everyone who has given their exam has cleared their exam. I'm not saying that it was very easy for me or it was like very difficult for them, but it's all due to circumstances, because we all have given our MBBS and then gave NEET PG and then secured, I won't say best or like worst, but we have secured a good amount of rank by which we got a clinical seat. So we all at one point we are good at our studies. The main thing is that it's just the time. So you need to utilize the time and then like make sure like whatever you're studying, it's important for the exam, that too first theory. So because theory and practical are completely different, and what you do in OT or like outside OT is completely different from what you study. I don't know about other like branches, but anesthesia, I can definitely say, because every day you will be giving spinal anesthesia or general anesthesia, and there are like different types of general anesthesia, and also you will be giving peripheral nerve blocks. But at some centers, you might not be getting the same cases, and same amount of workload will not be there, and same amount of exposure will not be there. So when you suddenly come to an exam, like to read or understand it, you will feel very overwhelmed that maybe this is not what I have done like from past 1 year, and what am I reading, because even there are many things that which I haven't faced. Like maybe I felt like maybe did I like under work or something. No, it is not the case, because not even any of your professors or like any doctors in their lifetime, they can't be seeing each and every case. That is not possible. So we need to learn how much, I mean, opportunity we have got, and then from the theory, like by studying or like by watching videos, or like continuously whenever you're free, you try to converse with your friends, like what is happening in their institute if they are free. And yeah, definitely nobody will be free to discuss so much in detail, but at least have some good friends or people who can at least tell you that maybe in a week, at the end of a week, just spend few minutes, like 30 to 20 minutes, and then like what are the like cases that you have gone through. If you feel like it's a new case, then you write it down and try to think about it, because I'm saying only these things if you are interested to learn or know, because many people are thinking so much to enter into this course. I'm getting a lot of messages, and I have been speaking to a lot of people, like they're very much like tends to enter into this course, thinking that they might spoil their life and time. That is the reason why I want to emphasize on these important points, because always remember, like even I understand that getting into something is not important. You need to maintain that thing. That is the most important thing, what I feel is like.
This
Yes, sir.
examination, how many papers would be there in the exam?
We have three papers, sir.
Okay.
Yeah, usually the like primary DNB and the MD, they have four papers, but we have three papers. So that is one plus point I can say.
Got it. Like all are essay questions or my MCQs. What is the pattern of that?
No, no, no. They're completely like a question and answer based, like no, not MCQs. It's like theory exam. Like they say that we have 10 questions per paper, but definitely it's not going to be 10.
Hmm.
In my first paper, they have almost given like sub questions. Like completely, it was around 21 to 22 questions in my first paper, and in second paper, it was around 18 to 19 questions, and in third paper, it was around 20 21 questions.
Oh,
So I won't say it will be easy, and I mean you need to write, and we have only 3 hours time. So writing 22 questions in 3 hours, that too like because even the question won't be small, like it won't be a one-liner question.
hmm.
It will be like lengthy. So you need to write, and maybe you need to think also, right, at that point of time. Maybe I felt like they are texting only our knowledge, because if you know an answer to a question, you will not be thinking. So they don't give us the time to think. So you should be ready to answer any question. Compared to my previous year batch, like their third paper was like entirely different from our third paper. And I'm seriously saying you, the third paper, some 3 to 4 questions, which they have given to us, like they haven't even given in past 10 years of DNB.
Oh,
Past 10 years of DNB. Not even DNB. Even MD people, like I can't say this, but few of my seniors or like teachers also, they're like, what is this? Like even they had to like search in the Google, like, what might be the answer for that.
got
It's
it.
like completely different. I know the third, like last paper, final paper, it will be like some newer advances, but we did not expect that they'll be asking us this thing. But somehow I tried to manage to read few things. So with that knowledge, I just cleared it. So yeah.
Anything from neuro anesthesia you got? Huh?
So yes, sir. Any questions?
Okay, okay.
Yeah, we got like uh, how should I tell you? It's like there's no difference between like subspecialties or like I mean different systems, but they have mixed everything together and they gave. Actually, I liked it, but I was little bit yeah tensed also.
So you have to prepare from beginning. So it's a tough exam, three
Yeah,
papers. Got
yeah,
it. So then the practical date would come later on, correct? No, it will be
yeah.
like
Almost yeah, like 1 to 2 months we'll be having so because all my senior he got like within just a month, so most probably I'll be getting by end of this month. Yeah,
so that is a single day exam.
yeah, single day exam. Yeah,
Okay, okay. That will happen in Delhi.
usually most of the people are like giving it in Delhi, so hopefully like even I'll get a center in Delhi or like in any other state. I have to be ready to like face anyone in any state.
So
Yeah.
here, one question many people from Tamil Nadu are mainly asking me. So if they get, for example, diploma in your place, West Bengal or some North Indian states, so how should they actually manage, language Hindi? Because they wouldn't be knowing. Even Andhra Pradesh people also wouldn't be knowing Hindi. Karnataka actually is better. They talk Hindi also along with Kannada. So how actually you did you have any problem or how did you manage?
No, like my Hindi was like pretty good, sir. So even I had this in my mind that I'll be choosing only states which are like nearby, like the language should be little bit proper for me because while choosing, I haven't choosed any other states except for I didn't even choose Maharashtra because Marathi is a completely different language. So I thought it will be a little bit difficult for me because in post graduation, patient like
Interaction.
interaction will be like so much that see many people think that anesthesia will not be having patient interaction, but to be frank we will be having during PAC. If you it's a very crucial step, sir. I don't know, people are only concentrating about OT stuff and like hands on and everything, but PAC is a very different thing. It
Yeah,
is completely based on your medicine skills. So for that you need to have conversation with the patient. If you don't understand the language, you'll not be able to give your best to uh, grab the history and everything.
correct.
So that is the reason like my Hindi was like far better, so I thought like I can easily like learn Bengali.
So
So that was
Bengali, you understand now.
yeah, I understand, I speak. uh,
Then
yeah,
you learned it, no? Then so like that.
yeah, I have learned it. No, I don't think if you are interested, it will be easy only because my junior, he's from Tamil Nadu. Okay,
Mhm.
even he can't even understand Hindi, but now he has learned little bit Bengali. He's
Okay,
trying to conversate with patients or like
he's managing at least.
yeah, he's trying to manage. So it everything depends on you.
Got
See,
it.
I won't say that you don't take in Maharashtra or like you don't take in any other state like that, but it's completely your point of view. But for me specifically, I thought like I'll be taking only in like Hindi states.
Got it.
I didn't even think about Bangalore or like Chennai because I don't know, I just wanted, yeah, that's it.
So next, what is the next plan of MD or DNB if you plan to do? So, which is better you feel going through PD set into DNB or going through NEET and MD? Which is better according to you? I mean, you must be having some plan, no?
Yeah, I'm pretty frank about this. Many people are asking me also, but I'm still not sure like whether I'll be taking DNB or like MD. Uh, because I still have thoughts running in my mind whether which to choose. But I can say few pros and cons which I have kept in my mind
Yeah, please.
regarding that.
Pros and cons, you tell.
Yeah, like MD, that is one plus point. That main plus point is that if you want to have a government job in future, it will be very easy for you if you have done your MD. And regarding people asking me whether you will be feeling inferior that you have done diploma or DNB, something like that, you will be having a MD degree, which you can actually feel like you can say that, yeah, I have an MD. So
Hmm.
for that. And third thing is that uh, it will be little bit easier to clear. I feel like it will be little
That
bit
is correct
easier to
only.
clear exams than DNB. Again, taking all the stress and because every time it won't be the same, right? And who would want to take the stress all of again, like after 1 year, 2 years, or something like that? So for that, and one more thing, definitely there will be a difference in management in hospitals versus medical colleges. This thing I can say. As I have done my diploma from a medical college, I can say I have little bit more privilege of like learning it in a very mannered way, as I can say, like regarding the theory or like classes or like anything. Huh. Main part is it will definitely depend on your HOD. Even if you have in a very small hospital, but if your HOD is good, like you'll be having a good hands-on and classes. And regarding like negatives for taking MD, again you need to go through NEET PG, which you have skipped for now that you can't be doing it again and you're taking diploma. Again, you need to go to NEET PG. And again, we are not sure after 2 years of studying only specifically anesthesia. Again, you need to work so hard to at least secure a decent amount of rank to enter into some private or like any government or something. It is not that easy. Again, if you get some 30-40K rank, you will be getting in a private,
Hmm.
no doubt. But in the first step, you have skipped it to enter diploma after getting the same rank. So it's like first of all you choose wisely, like whatever you're choosing. I won't say this is bad or this is good, but this is about MD. Regarding DNB, it is quite easy to do a secondary DNB because PD said we have only specific department questions. Like if I take this branch like anesthesia, we'll have only questions from anesthesiology, all the physiology like pharmacology and everything, pathology, like but not as NEET PG. So that is one plus point. And almost whoever clears diploma and then enters into PD set, they will secure a seat in secondary DNB. I can't say that you will be securing in the best hospital, but you will be securing a seat. For
But
that, you need to work hard again. Again, the same rat race. Like if you want to get in a very good hospital and like nearby to your home, you need to secure good rank. That is also competitive, like same as NEET PG, but it's PD set, so you'll be having lesser number of people who will be competing with yourself. That too only your branch people. So that will be that.
I think only
And
300 people will
yeah,
be said. That's it.
yeah. That's it, sir. And coming to some negatives, like same again, the stress will be the same. And again, you will be thinking the same that will I be inferior like compared to MD people or not? And will I be getting a government jobs or not? Like if I do DNB, that also you will be thinking. But
We'll talk about this
personal,
inferior part. Say diploma if you do while you're getting trained. MDs also will be there no, along with you. So
but no, but in my college we don't have,
MDs
sir,
are not.
because yeah, like NBMS anesthesiology like diploma courses are different.
Okay, okay.
uh, State diploma courses are different. For example, in Medical College Kolkata,
Hmm.
we do have diploma course in anesthesia.
Okay.
Even now we have one
Okay.
of juniors like who has spoken to me last year. He has
Okay.
taken there. He is not doing NBMS anesthesiology. He is
Hmm.
doing a diploma anesthesiology, which is a state diploma.
State diploma.
Yeah, with him he'll be having MD students. But The people who are doing NBMS and so specifically when you see in the list of your
Mm,
like ranking list,
yeah.
we won't be doing with any other like MD students. We will be only either doing with the secondary DNB students or primary DNB students or diploma students.
Okay. Primary DNB and diploma. Will there be any differentiation?
Uh,
Both almost.
I don't think so, sir, because if you are joining in the first year, you all will be first years only.
Got
So
it.
you will not be knowing anything. Because how I'm saying is like here we have in gynae like OBGY, we have primary DNB, secondary DNB, and also diploma courses. But I don't see that they are showing any differentiation. Like as much as I know, but I can't dig into deep and ask them regarding like do you see any differentiation and or not. Even if you see differentiation, I think we should skip that part
Mm,
because there will be a lot of negative surrounding you. What you attract will come to you. So at least try to. We can't avoid everything 100%, but try to avoid few things.
got it.
I feel like because basing on this, you can't be taking a course.
Got it. So
Yeah.
I think
Yes.
then it is not there then, based on what you're telling.
Yeah.
So, and next thing is the when you're choosing the medical colleges, and we have done a video, but can you briefly tell us how to actually choose, because almost like 200 300 centers are there where this diploma in anesthesia is there basically. So among them, most of the guys wouldn't be knowing anything about the place. So how to intelligently choose that? Some techniques or something.
Like there are a lot of Telegram groups.
Mm.
I would say if you have so much of time before your counseling, as you are like stressing so much about taking your seat because that is your future, so spend as much of time you can and like don't feel shy or like don't feel like why am I keeping on asking someone